All right, silicone granulomas. So this is a crummy problem. So how does it happen and what are they? When you have a silicone breast implant, you have a silicone sac with a silicone gel inside. The older implants had a more liquid gel. The current implants have a firmer gel. We call that cohesive. And even the ones on the market now, there's kind of differences in how firm they are. There's very firm ones and kind of firm ones, but there's really nothing on the market like the really old implants where the silicone was more of a liquid. Now, if that outer shell breaks, the silicone inside the implant can escape. Now, sometimes it'll stay right inside that scar tissue sac your body forms called the capsule, but sometimes it can get out and end up in the breast tissue, the lymph nodes, or even farther away. Now, when this silicone escapes the capsule and ends up in the breast tissue, your body doesn't appreciate that escape attempt, and you'll get lots of inflammation, and that area will become what we call a silicone granuloma. So it's basically your body's reaction to that escaped silicone from within the implant. So silicone granulomas sometimes are just a firm mass and they don't bother patients, but they're often painful. Sometimes you can have redness over them, and then often with time your body will push the masses up to the surface. And I've even seen patients with older implants where the silicone broke through the skin and started oozing out. Now, this is one of the reasons if you have a ruptured silicone implant that I always recommend switching it out. And I know some people say that if there's no trouble with the implant, there's no reason to do that. I don't agree with that because I don't want patients to end up with silicone granulomas or silicone throughout their body for no reason. Now, silicone in the lymph nodes is another thing we commonly see with ruptured implants, especially when they've been ruptured for a long time. It doesn't typically cause any trouble, but it can. So in my opinion, if you have a ruptured implant, get that guy out and get a fresh one in. Now, when I take implants out or revise implants in patients that have silicone granulomas, I typically try to remove them. Now, it's not possible to remove all of the silicone that escaped the capsule, but you can find these silicone granulomas. They're usually hard, painful, distinct masses, and remove them at the time of the explant or of the breast implant exchange. I think that's really important because they just typically tend to continue causing trouble for patients. So I do my best to get them all out. I've seen women from many, many years ago, and unfortunately some recently, that have had free silicone injections. Now, that's not something that we do in the United States, but it's still done outside of the United States, where they just inject silicone with a syringe throughout the breast, and the patients ended up with granulomas all over the place, and it wasn't really possible to remove them, and the patients ended up with a mastectomy. So hopefully that answered your question about silicone granulomas. Let me know if you want to know anything else.